Good afternoon, everybody. I'm Sayukta, your host for today's live from All About Skin Wellbeing team, and I'm sure all of you must be keeping good health. Today, we are going to discuss about our skin health with focus on urticaria or hives, which we or our near and dear ones would have encountered at some point of time in their lives. Urticaria is characterized by a round rash on the skin that itch a lot. It may be due to certain chemicals in certain food items, allergy to certain medications, insect stings, sunlight, and sometimes the causes unknown. As per study published in the Indian Journal of Dermatology, Venereology, and Leprosy, more than one-fifth of the population suffer urticaria at one time. 60% of patients are in the age group of 20 to 40 years. Incidences are higher in older age groups. Urticaria is classified as acute and chronic. But the most important part is not to ignore it, and doing self medication can actually worsen these symptoms. Consult your nearby qualified skin specialist immediately for an early remission. In today's digital world, it's always a boon or blessing if we can get to hear from an expert dermatologist online about urticaria and its types, how we can prevent it, the kind of tests required for its diagnosis, the right treatment and management approach for an early relief. So today we have with us renowned dermatologist Dr. Rohini Soni, who has done her MBBS, MD, and DVL. She is also the member of IADVL and currently working as consultant dermatologist at KVR Hospital, Moradabad, Kashipur. Her skill and compassion have made a tremendous difference in patients' life. A very warm welcome to you, Dr. Rohini Soni. It's a pleasure to have you with us.
Thank you. It's my pleasure also to have you that you are welcoming me on the great show, which is all about skin well-being, and it is focusing on various issues which most of the people suffer from day-to-day life. And I
Right. Yeah, doctor. And today we are going to talk about urticaria. And the biggest problem with urticaria is that it is very common, but then many a times people keep on suffering in silence. They won't come up or take advice from the right person, which is a qualified dermatologist. So, doctor, to start with, what is urticaria?
Actually, urticaria is defined in the medical terms as something which comes up with erythema. Erythema, in general language or layman's language, is redness with
Mm.
some raised lesions, which we call as wheals or sometimes hives. It is usually accompanied by itching, and sometimes when the urticaria persists for more than 24 hours, it may cause burning sensation as well. Mostly urticaria presents in the form of wheals and hives only, but sometimes it is also accompanied by some severe swelling of lips, eyes, and in severe cases, it may extend up to the laryngeal walls, leading to angioedema, and sometimes patient may fall very sick and goes into shock.
Right. We'll talk on that as well, doctor. But before that, what are the various causes that could trigger or cause urticaria?
Urticaria has many causes. It is very difficult to define a single cause about urticaria. When a patient comes to us to tell that we have urticaria, the first question I ask is, isn't it from a smaller period of time or a longer period of time? And chronic urticaria. So, in case of acute urticaria, the causes are minor, which means some mild infection and some kind of parasitic infection, kind of viral infection may cause urticaria. It is self-limiting and it goes on its own. But in case of chronic urticaria, which exceeds more than 6 weeks, it is very difficult to point out a single cause. There can be a food allergy, there can be a physical stimuli, there can be exercise that can cause cholinergic urticaria. Some patients have solar urticaria, which is caused by sunlight. Some patients have water urticaria, which is also known as aquagenic urticaria. It is very difficult. And in few cases, it is autoimmune urticaria, that some kind of infection has occurred in the past, some IgG antibodies are formed, and that is causing urticaria again and again. So there is no outer stimuli, the stimulus is inside the patient itself. So it is very difficult to define which type of urticaria, but with proper history taking, you can come to a pinpoint thing that it could be due to some particular type of thing.
Right. So diagnosis becomes very important so that we can avoid or, treat the root causes. Now, doctor, initially you said that mostly it appears to be as hives. So there is this rash which is bummed, and then there would be itch and all. But then you also said that there are, few stages where it could be the swelling of, lips or foreheads, etc, and many a times it could be difficult to breathe as well for the patient. So we would like you to shed some more light on the things where it becomes really severe or it could be life threatening.
Could you please repeat the question?
Sure. How severe could urticaria be?
Urticaria could be very severe in few cases. In most of the cases, it is just irritating. It is severe itching. There is a discomfort. There is sometimes burning sensation. Sometimes lack of sleep. So there is a discomfort overall. But in few cases, when it involves the inner mucosal walls, it causes edema. Leading to lack of breathing, causing dyspnea, and it may become life threatening. In that case, even intubation has also been done. Has also to be done.
Right. And you also mentioned that we can classify urticaria in acute and chronic, and many times in acute, the causes are very, are such that which could be very easily treated or avoided in case of allergies, etc. But in chronic, many a times the causes are unknown, or we can't find out why it's happening. We would like you to tell us, doctor, because many a times, especially the people who are suffering from chronic urticaria, their usual question is, will it get cured permanently? I'll get permanent relief from it ever?
Actually, this is a very difficult to answer such kind of questions to a patient, because once you have allergy, you have allergy. It is not possible that you omit your allergy from the body. It is possible to decrease the symptoms, but it is not possible that once you have allergy and you'll not be having an allergy if you take medications. It is not possible.
And doctor, there's one more thing, in case of allergy or in case of urticaria, because we have so many information these days. There are so many platforms from where we can get information, and the one thing that most of us do is to go to a chemist, get an anti-allergen, and it will give us some immediate relief, and we'll feel that we are fine. We don't need any further treatment, etc. And that's why immediately, or in the first place, we don't go to the doctor because we have these pharmaceutical shops and anti-allergens, etc. What's your advice on taking an anti-allergen? Is it good, or it could be harmful in the future?
Actually, anti-allergen is antihistamine. It is the drug which stops the histamine to release, and it will cure your symptoms symptomatically. It is a symptomatic treatment. It will not cure your problem, basically. It will
Right.
decrease your symptoms. You will feel good for a while, but again, it will happen as soon as the effect of the medicine goes away or weans away. You will again feel the similar symptoms that the allergen is close to you. The first step is to find the allergen, which is not possible for a chemist to find out. It is possible for a doctor. We can perform various tests. We can have a proper history to find out what the allergen is. To take a single antihistaminic, again land into the same problem, again taking antihistaminic, it is not a good method of treatment. It is always advisable to have a consultation with a good doctor, so that you find out what the problem is, find out how can you do the solution, and various solutions available. Because chemist doesn't know everything. He can give a
Exactly.
levocetirizine to you, you will be okay for a while, but not always.
Right. So if you want to go to the root, if you want to find out what's causing urticaria in you or what's triggering urticaria in you, and you want to, get permanent cure and relief, please go and visit a qualified dermatologist at the very first place. Don't delay, don't self-medicate, don't go for over-the-counter medication. Now, doctor, the thing is, as you said, that it's important to find out the root cause, and it will always only be possible through some tests or diagnosis, etc. What tests you normally advise to patients who come with you with urticarial rashes?
For the urticarial rashes, if the patient has a chronic, for the acute patients, I don't give any tests. But for the chronic patients, I usually go for, sometimes I go for skin prick tests to find out the allergens. Sometimes I go for the ASST test. For ASST is autologous serum sickness test. And it is usually done to find out the cause that the urticaria is autoimmune or not. Because autoimmune urticaria, there is no allergen you will find. There are antibodies you have to find out. And in that case, if you inject the serum itself in the patients on a weekly basis, the condition will cure. So we have to find out. And there are some RAS test is also available, which is radio absorbent assay. That has to be done so that we can find out the type of allergy. So there are many methods to find out.
Fair enough. And doctor, what are the potential complications of urticaria if left untreated?
In most of the cases, the complication in minor cases, actually the complication is so irritated or uncomfortable with the condition that he becomes he becomes actually very angry. I have a condition which is not treatable. Nobody can treat it. I'm having a levocetirizine. I'm okay. Again, I have to take it. I have to take it daily to help myself. So it is very difficult sometimes. But in few cases, the patient lands up in angioedema. There is a life-threatening condition. Patient has to come to hospital. He has to be hospitalized. So they are the conditions which he can land into. And if the patient goes to that Bengali doctors, Babaji, and everywhere we have available such kind of doctors, he will give him steroids for the treatment of urticaria. And with steroids, he will land into some other problems such as osteoporosis, peptic ulcers, gain of weight, many other problems. It is very difficult to define right now. But I always advise to come to a proper doctor, to have a proper consultation, to have proper investigations, then do what you want to do.
Exactly. So please don't waste your energy, your time, your money, and most importantly, your health over quacks or, for over-the-counter medication, etc. Go to the right person, which is a qualified dermatologist. Now, doctor, as you said, the patient who is suffering from urticaria, especially chronic urticaria, there's so much of stress. They are so annoyed, irritated. They are completely, all the time. They are just itching their lesions and all. Can urticaria be caused or aggravated by that stress?
Yes. Stress is the factor which can aggravate any type of stress. With stress, mast cells release more of histamine. The urticaria becomes more progressive. Number of lesions increases. So it is have a calm, a cool breath. Proper treatment is the only treatment.
Many times people complain that their urticaria or hives get worse during night. What could be the reason for that, doctor?
Most of the times when urticaria comes during night, the common reason we find out is bed bugs. Bed bugs or any kind of ticks sometimes are there. Some bedding has some dusts which has to be removed. So most of the times, the physical stimulus is common when the patient have urticaria only at night or early mornings. I usually advise to have the clothing to put in the sun and to check the bed if there is some bed bugs, because sometimes there are many cases there are. To remove the bed bugs, to change the bed, go sleep on some other bed and find out you have the same or not. So these are the things we can do to find out what is the problem.
And is there any dietary precautions or do's and don'ts for patients of urticaria?
Diet is that we have to omit few things such as seafood, such as meat, non-veg, such as egg whites. We have to omit some nuts has to be omitted because in most of the cases these are the allergens. When we don't pinpoint allergen, we have to omit few things to find out what would be there. And in few cases we also have to omit tomatoes, garlic. These are the things we omit from the diet, and then we see is there any improvement or not. And this type of diet is known as pseudo-allergen diet.
Right. We have Purvi Mehra with us, a viewer, and her question is, what are some lifestyle changes I can make to improve my overall health and well-being?
It is the question is related to urticaria or otherwise?
No, I think it's to her overall health, but yeah, let's skip it because it's a kind of a vague question. And of course, I think the probable answer would be definitely that a good lifestyle will help her going a long, long way. Doctor, many a times, we have seen, especially in last 2, 3 years during COVID, that people who were COVID positive complained of having hives or urticaria. Is there a correlation between COVID or any other viral or bacterial infections?
Any viral infection can cause urticaria. It is very common that the patient which comes to me and says that he's feeling urticaria from 15 days, from 20 days. I usually ask single question that क्या आपको 15-20 दिन के अंदर कुछ बुखार आया था? So then he says yes, मुझे 15-20 दिन में आया था. So we correlate it with that there would be some viral infection. For we have a post-viral urticaria. So it is very common. Any type of viral infection can cause urticaria due to its structure, due to the structure of the viral shell. It becomes the allergen and it causes the release of histamine.
Okay. Is urticaria contagious, doctor?
No, it is not at all contagious. It is your own body which is allergic to some things. It is not contagious from you to your child to anyone.
Okay, and as you mentioned, child and kids, many times we have seen again, after fever or something, kids do get hives and all. So the treatment is same, or what we as parents are supposed to do?
If it is mild itching is there, we only give topical treatment because it will suffice. But in case if we have the severe symptoms of urticaria.
Yes, doctor, we lost you for a few seconds, I think. Can you just repeat? I mean, definitely, as you said, topical treatment could be there for, in case of children, it will subside the thing. But what else you said we couldn't register?
I said that in case the condition is severe, if the patient has multiple times the episodes of urticaria are there, after a viral infection, simple and good antihistaminics, which could be given to the children at that age, can be given, and it relieves the symptoms. We don't have to go for the multiple types of drugs in case of children having urticaria post-viral.
Okay, doctor. And in general, what are the treatment options available for urticaria?
Actually, the first line treatment for the urticaria is to find out the allergen. And then for treating the symptomatic things, we have to give few antihistaminics. If it is not relieved by the single antihistaminic, we can add other antihistaminic for the day and night or increase the dose to 4-fold. If it is still not improving with that, we have to add the second line treatment, which is usually cyclosporin, which is immunomodulated drugs, or methotrexate, which is again an DMARD, immunomodulated drugs. Other way we can do. It is known as Xolair or omalizumab. We give omalizumab to the patient with chronic urticaria, not relieving with any of the things. And it is a very good. It is also given sometimes in asthma.
Okay, doctor. And doctor, before we sum up the whole session, any take-home message for our viewers?
The only message I want to give that please do not take over-the-counter prescriptions. Do not go to the doctors or people who call themselves as doctors and they are not qualified to treat you. Consider your condition as a bimari and go to a proper person. Take the proper treatment, have a proper diagnosis, come to a point, and then treat yourself.
Thank you so very much, Dr. Rohini Soni, for your valuable time. It has been a very informative session for our viewers, and I'm sure they'll use this information to prevent themselves and their near and dear ones from getting urticaria. And in case if they get to see any such symptoms or signs, they at least now know how to get it treated and how important it is to go to the right person rather than doing self-medication. It was wonderful hearing to you. Thank you so very much once again.
Thank you.
And viewers, thank you for your active participation in today's session. And to get latest updates on how to keep your skin healthy, do like and follow our FB page all about skin well-being. We are also available on YouTube, Twitter, and Instagram. Thank you. Have a good day ahead. Goodbye.